So in chapter 16, we're going to take a look at how your immune system handles different types of allergens or antigens that get in the body. We've already talked about all the different parts of the immune system, how it recognizes different antigens, how it can tackle if it to get rid of it. But we're going to talk about some of the ways that sometimes that process isn't always the best. Sometimes our immune system can get a little crazy, a little excited, overexcited about seeing different types of antigens in the body. So the PowerPoint's going to go through, a little review, the B cells, the antibodies that are made, and how they can develop into those allergies if any of you suffer from any kind of allergies. We'll talk about what allergies are, because a lot of people do have hay fever type allergies, especially in the spring and in the summer, but you can have an allergic reaction to lots of different things, where you might have allergic reactions to something, but other people don't. So some people are allergic to certain foods, different pollen, different types of plants, different types of animals. Again, it's how your body recognizes those foreign things in the body. We're going to talk about a little bit about red blood cells and blood types and how they can cause immune reactions. A little bit with the T cells, it's not all B cells. What can happen with that major histoability complex antigen found on your cells and how it causes issues with transplants. We're also going to look a little bit about at autoimmunity, where it's your own immune system is attacking itself, which is never good, and how you can develop a weakened immune system. There's lots of different things that can cause you to have a weak immune system, which leads to unfortunately, a lot of bad issues that come from that. So, some terms to kind of go over. One, immunopathology. It's looking at the disease and anything that can change the immune system itself, whether it's causing it to be overactive, underactive, but it's anything that's causing the immune system to change. An allergy is an exaggerated, misdirected response to something, to some type of allergen, to some type of antigen. So if you have an allergy to pollen, or if you have an allergy to cats, it's your immune system's, over or exaggerated response to it, where other people can be around cats all day long. However, your immune system recognizes that dander, the cat, as a foreign antibody, as other immune systems do, but they have an exaggerated response. So your immune system is just a little too excited when it sees certain types of antigens. And autoimmunity, anything auto means self. So an autoimmunity is anytime you have an abnormal response to your own body, your own self antigens. Immunodeficiency is if you're losing immunity. And then a cancer, we'll talk a little bit about, but we're going to talk about what can cause cancer immune system-wise, or how it can affect the immune system. So kind of just looking a little bit at this chapter, different types of immune responses are broken down into types. There's a type 1, type 2, type 3, and type 4. We're going to focus mostly on the type 1, 2, and 4. It doesn't mean type 3 is, not important as well. It's just we're going to focus on types 1, 2, and 4. Generally, these are the ones that are more common, things that you may have, someone, you yourself have dealt with some of these, or you may encounter them more likely in your future. So a type 1 allergy, they're always going to be immediate. It's your body is recognizing something as foreign, and you're going to have that allergic reaction, that exaggerated hypersensitivity response. However, there are two levels of severity on how your body reacts to those foreign bodies. One is atopy. It's just it's a local allergy. So it stays kind of wherever that allergen is. So hay fever, you breathed it in, so it's going to have some type of response on your respiratory system. So it stays put. Anaphylaxis, this is a systemic, meaning it's going to affect body systems. So it's widespread throughout your body response. This is where we run into a big issue, because it can cause airway obstruction and your entire circulatory system to collapse. So people can go into anaphylactic shock. So if you're going to have one type of type 1 allergic reaction, you're going to want the atopy one, not anaphylaxis. You want it to stay local. Now, some factors that can affect your allergic or your allergy response. One, if some people are just predisposed to getting allergies. Some of it's genetic, not always though. Allergy responses can be affected by age. They can be affected if you have other infections. They can even be found in different geographic areas. So if you travel, you may experience some type of fungal spore that your body's never breathed in before, and you could suffer from allergic reactions. Now, the atopic allergies may be lifelong, or they might be outgrown. So you may have had allergies as a kid, and then maybe you outgrew them. Or they could reverse and develop later in life. So maybe you never really had any allergies as kids, but then as an adult, you started to develop allergies. I'm in that situation. I never had allergies as a kid. As I've started to get older, I start to get some of those spring hay fever type symptoms from pollen that's in the air. Now, different places that these allergens can get in the body. They typically enter through the skin, respiratory system. You're breathing them in. You can ingest them, different food allergies. They can get, on your skin itself. Depending on where they got in, it could affect where the allergic reaction happens, but not always. So some different ways they can get in the body. One, we have a whole group of different types of allergens. We call them inhalants. So it's just anything that gets in the body because you breathe it in. There's ingestins. These are going to be the ones they only get in the bodies because you ate them. A lot of different types of food allergies or different types of drugs. If you are allergic to certain types of medicines, well, you have some type of drug allergy. Well, it gets in the body because you ingested it. There's different types of injectants, whether it's some type of insect venom, whether it's some other type of insect bite, whether it's different types of drugs, different types of possible hormones or enzymes that need to be given. There are different things that can get in the body that get in there through an injection. And then there's also some that get in the body because they get in through the skin. So there are topical drugs that we can put on our skin. Cosmetics can cause allergic reactions, different heavy metals, detergents, formalin. I don't know if you have too much exposure to it, possibly in the healthcare setting though. Some people are allergic to rubber. So there's lots of different types of things that they get in the body that cause allergic reactions. A lot of times these contactants, the one that you're picked up through skin, most of them cause some type of skin allergy or allergic reaction just on the skin. Not all of them, though. Some could go into anaphylactic shock. Now, development of an allergy. There's kind of two big steps to developing an allergy to something. So if you have allergies, you went through both steps, whether you realized it or not. The first step is called your primary contact or sensitization. So it's the first time your body's ever been exposed to an allergen. So an allergen, it gets in the body. We've already went over lots of different ways it can get in, but you've got an allergen, it's in the body. Now, generally the first time you're exposed to something, some type of antigen, you don't generally have any symptoms. It's no signs, no symptoms. It's just your body is like, oh, that's what that thing is. And it kind of alerts and wakes up your immune system to that particular allergen. So on the picture, it's the little red allergen dots. So they're going to activate T helper cells. That's going to activate some of your B cells. Your B cells are going to make plasma cells. Your plasma cells are going to churn out antibodies. Now, those antibodies are then going to attach to mast cells in different tissues in your body, as well as basophils. And these are going to float around in your body, kind of just waiting for that allergen to show up again. Your immune system is now primed for a stronger, more effective immune system response. You have these antibodies towards this little red allergen, and they are waiting for you to have a subsequent exposure. So the subsequent exposure is called the provocation. We're ready for it, but if it gets in the body, so that little red allergen, It's in the body a second time. It's going to be bound to the antibodies on the arms, on the hands. It's going to recognize it. It's going to trigger the mast cell or the basophil to start releasing some of its mediators into the bloodstream. And depending on what it releases, it travels around the body, and it can end up with various types of symptoms depending on what the allergen is. You could have the red itchy eyes, you could have hives, you could have a runny nose. Depending on what it is, it could put into anaphylactic shock. So the first time you've ever been exposed to something, you generally know signs and symptoms. It's just every subsequent exposure after that, it's your immune system recognizing that allergen again. It's primed and ready to do something about it, and it releases those different chemicals into the body that's going to cause you to have all the allergic reactions. Yay! So those mast cells and basophils that the antibodies attach to, so they're located in different parts of the body. They're constantly just patrolling, circulating around in the body. They can attach to anywhere between 10 and 40,000 antibodies, your immunoglobulin E's. So each cell can bind 10 to 40,000. The picture shows 4. That's easier than trying to draw 10 to 40,000 of them. But each cell can bind a whole bunch of antibodies. And it's these cells, they contain various types of chemicals, cytokines, histamine, as well as other chemicals that get released into the body to cause those allergic reactions. So it's those cells triggered by the antibodies that are recognizing that allergen that's going to cause all of your allergy symptoms. So some of the different types of chemicals that could get released. So depending on the chemicals, kind of depends on what kind of immune system reaction you're going to have. But general targets, these chemicals are going to head to the skin, the respiratory tract, your digestive tract. They can head to the eye, leading to rashes, itchiness, redness, runny nose, sneezing, diarrhea, as well as that, tearing up. Other parts of the body, though, they can head to muscles, they can head to mucous glands, they can head to your nervous tissue, they can change blood pressure, they can change respiration rate, and that's when it gets scary and when you can have more severe reactions. Now, histamine, one of the mediators that can get released, it is generally the most profuse and fastest acting, which generally means if you are having an allergic response to something, histamine is one of the main and fastest chemicals that gets released into the bloodstream. So if you're having an allergic reaction, the thing you take is an antihistamine. It tries to counteract what the histamine is going to do. Because the histamine's response in the body, it can constrict smooth muscles of the respiratory tract, your intestines, as well as relaxing other vascular smooth muscles. So you can take antihistamine drugs that counteract what histamine does. Serotonin works with histamine. Leukotrienes, they generally have more respiratory, asthmatic type symptoms. Prostaglandins cause inflammation, and the bradykinin generally causes almost a slow cardiovascular reaction. Like, none of it good. So depending on where those different chemicals go, and I'm like, they can target different parts of the body. A lot of it's respiratory, and that's always going to be the biggest concern, is how is it going to affect the respiratory system. So some atopic disease, again, these are going to be the ones that it's generally a localized reaction. It generally doesn't go into that anaphylaxis. If you're going to have, some type of type 1 allergy, you'd rather have it an atopic disease. And it's the hay fever, the runny nose. A lot of it's seasonal. A lot of it is because you're inhaling things that are in the air during different seasons. It could be topical if you're out hiking and there's some type of poison ivy. It could be you ingested something, some type of food allergy. It can cause atopic dermatitis. Eczema is an atopic disease. Food allergies, again, food allergies, most of the time you're going to have some type of skin or respiratory tract change. It could be difficulty breathing. You're going to have usually some type of almost a rash or hives, but it can cause vomiting, diarrhea, abdominal pain. It could cause anaphylactic shock. And I'm like, people that are allergic to peanuts, it definitely can cause anaphylactic shock. I'm the person, I'm like, I have a type 1 allergy to fish. Luckily, I'm like, I don't have any type of anaphylactic shock. It just causes the vomiting, the diarrhea, the nausea that go along with different types of food allergies. Drug allergies, depending on what type of drug, it can have a lot of different side effects. If you ever listen to any of the commercials that advertise drugs, and they always have and it could cause, and they list for 30 seconds all the different side effects. Different drugs can cause a lot of different types of allergic reactions. It could be mild, maybe just a possible rash, all the way to difficulty breathing and death, which is never the side effect you'd like to hear. This is just showing some of the type 1 atopic skin allergies. The first one is the eczema, the atopic dermatitis. Another on the right side is a skin rash from a food allergy to strawberries. So anaphylaxis is usually a reaction of animals, including us, when you're injected with a foreign protein. So something in the body that our body recognizes as foreign. This could be different food proteins, anything that has a protein. Now, anaphylaxis is generally that widespread, full body system type of reaction that can lead to difficulty breathing, can lead to convulsions. It could be something simple as just itching and sneezing, but it usually leads to something more severe, and it can cause and does cause death. Now, there are two types of anaphylaxis. Cutaneous is going to be more of the severe skin reaction. You're going to have severe inflammation shown up on your skin. Systemic is when it's going to cause issues to your respiratory and circulatory systems. Now, to diagnose, because sometimes you want to know if you have allergies to something, they can do different types of skin testing. Is they're going to take small fragments of different types of allergens, they're going to inject them under your skin, and they're going to look to see what is your body's response to those small allergen. Is it going to stay put? Is it going to spread? How much inflammation is going to be there? And so they inject just small, tiny little bits, and they're going to look for those inflammation. If you have inflammation, you're going to have some type of allergic response, as your immune system is recognizing it, and it's going to have that stronger immune system response. Now, treating. Well, you could try to avoid the allergen. If you know you have a food allergy, don't eat it. But you can't always do that. If you have allergy to pollen, you can't stay in a bubble all the time. But you can take different types of drugs that can inhibit the actions of different types of white blood cells or those mediators. You can take antihistamine. Now, for people that suffer from a lot of allergens, they don't want to be taking antihistamines and drugs every day for the rest of their life. So they do try to do what's known as a desensitization or a hyposensitization. It's constantly injecting the body with very small doses to the allergens so that the body truly just gets used to it. Not enough that's going to cause a severe reaction, but enough that the body will kind of just slowly gets used to that particular allergen. The Allergy Associates of Lacrosse, if you ever hear their commercials, that's what they do a lot, is they are training the body with small doses to get used to various types of allergens so that when you are exposed to them on a daily basis, that your body doesn't have as strong of immune response because it's used to seeing something. Now, it's not always possible to do that with every allergen, but with a lot of allergens, we can do a desensitization. Now, type 2 hypersensitivities, these are going to be ones that are going to cause some type of cell damage. So they're going to lyse or destroy foreign cells. It still is going to involve antibodies recognizing foreign cells. And the two main times that type 2 sensitivities happen are blood transfusions with the blood groups and the Rh factor found on blood cells as well. So, little A and P review of different kinds of red blood cells and their antigens. So there are 4 main types of blood types, AB, and O. And they're named for the dominant antigen that's found on there. So if you have blood type A, it's because you have A antigens on your red blood cell. If you have blood type B, it's because you have B antigens on your red blood cells. If you have blood type AB, you have both on your red blood cells. And if you're blood type O, you have none. It means you don't have A or B on your red blood cells. Now, tissues other than red blood cells can also carry those A and or B antigens as well, but we're focusing just on the red blood cells. So this is just showing the different types of blood types, the 4 main blood types, and then the main antigen that's found on there. However, although you may have an A antigen if you're blood type A, you have an A antigen on your red blood cell, but in your plasma, you have antibodies to other of the antigens. You don't have antibodies to your antigen, because otherwise antibodies would recognize your antigen and target it for destruction, but you have antibodies against any of the other antigens. So if you're blood type A, you have antibody against the other antigen, which is B. If you're blood type B, you have an antibody against the other antigen, which is A. If you have both antigens, well, then you don't have any antibodies against A or B, because otherwise either would recognize these to target. And if you are blood type O and you don't have any antigens whatsoever, A or B, you're going to have both antibodies, because there's nothing on your red blood cell for them to recognize. Oh, I kind of just went over that. So I believe it's an advanced AMP. You guys do blood typing, but you may have done it in other classes as well. Now, this is just to show, and I'm like, when we do a blood type A, when we add antibody A will mix with the antigen A on your blood type. So if you're blood type A, you have antigen A. And if it's mixed with antibody A, it causes clumping. It's called agglutination. Again, the word glue is in there. It clumps the red blood cells together. Now, clumpy blood is not good, because that clumped blood together, eventually those red blood cells are going to burst and die, and they're not going to be able to do their job of carrying oxygen throughout the body. If you're blood type A, because we add a drop of antibody A here, we also add a drop of antibody B here. And so if you're blood type A, if antibody B is added, you don't have any B for antibody B to recognize. So nothing happens. If you're blood type B, well, you have B antigens on the red blood cells. And when mixed with antibody B recognizes antigen B. They're named for each other. Antibody recognizes antigen. And when it recognizes it, it attaches them together. It clumps together. There's your agglutination. It tells you that you're type B. But if you're type B, you don't have any A, because you're only type B. And so no clamping will happen with your antibody A. Now, if you're blood type AB, means you have both antigens, A and B. So if you're mixing them with antibodies, A and B, clumping will happen in both. Type O, you don't have any antigens. You don't have A or B. Your red blood cells look nice and boring, which is a good thing. Is why generally the Red Cross is going to be, hunting you down, because your red blood cells look nice and boring. And we're not going to have a lot of clumping. We're not going to have reactions with antibody A or reactions with antibody B. Because what can happen is, if you are here's my type A donor. If you're a type A donor and we have a type B recipient, so type A blood, type B recipient. If you're type B, I'm going to go back to this. If you're type B, blood type B, means in your plasma you have antibody A, the opposite antibody. But the donor's A, and you have antibody A, which means that recipient's antibodies are going to recognize the donor's blood type. Those antibodies with their arms and their little hands are going to grab onto that antigen A. all over the red blood cells. It's going to clump it together. There's the agglutination, the gluing together. And eventually, all those antibodies are going to trigger complement proteins to cause the red blood cells to die. It's why we don't, why we do blood typing, so we don't give the wrong blood type to a patient, because otherwise that patient's antibodies would recognize that foreign blood and it would cause that lysine to happen. Now, the other time this becomes an issue too is with infants and the Rh factor, because there is another antigen on red blood cells, or there can be, the Rh antigen, also called the D antigen, and this becomes an issue if if a female is Rh negative. It means their body doesn't have the Rh antigen. Now, I'm Rh negative, so I always use myself as an example, because I think that's 15% of the population is Rh negative. Now, I have 2 kids. Unfortunately, I don't know the blood type of my kids or my husband, so I make up the story. But we're going to assume, which odds are, that he is Rh positive. And so we're going to say some of our kids could be Rh positive as well. So after childbirth of the first infant, some of the blood from the infant who might be Rh positive could leak into my bloodstream during childbirth. There's a lot of blood that can be mixed during childbirth between mom and infant. Now, that's the first time the body would see that new Rh antigen. And so again, it's that first step that the immune system recognizes it and becomes primed for any subsequent exposure, meaning any subsequent child. So the first Rh positive child of an Rh negative mother, there aren't any issues, because the body, it's not until childbirth that the body becomes exposed, that my body could have become exposed to the Rh antigen. The issue then becomes, once the body is primed to that Rh antigen, any other infant that is Rh positive, my body would recognize that Rh antigen that's a foreign antigen. We don't like foreign stuff. So the immune system would actually start to try to target that fetus's red blood cells. They would recognize the fetus red blood cells as having that foreign Rh antigen on them and target them for destruction. Well, that's not good if a fetus's red blood cells are being targeted for destruction. It could lead to serious complications that the tissues are not getting enough oxygen. It could lead to death. Now, this is just showing, the first Rh fetus is going to expose that Rh antigen to mom, and then mom makes antibodies so that any subsequent exposure, the antibodies would recognize that fetus. But we'll get to the ROGAM in a second. So the prevention, to try to prevent that, because that can be deadly to any subsequent exposure, is you're given a shot. They're antibodies that are going to bind up antibodies. So they're antibodies. They're antibodies that target antibodies. So my body has antibodies all over it. And again, I'm assuming this happened because I'm negative and odds are my kids are positive. But I've got antibodies that are constantly trying to patrol for any Rh red blood cells. However, you get a shot called ROGAM, and the ROGAM has antibodies that actually bind up my antibodies. So that my antibodies are already busy. Like, they're bound up already from the shot, that they're too busy, they can't be looking for anything on a fetus. So the fetus becomes protected during pregnancy. So it's kind of I give myself as an example, I'm Rh negative, odds are 85%, my kids probably were too, so yes, you got to get the shot. So any female that's Rh negative, so if you're A negative, B negative, AB negative, O negative, if you've got the negative part and you're going to have kids, expect the shot. Now, a type 4 sensitivity, hypersensitivity, it's a delayed hypersensitivity. So you're going to have some contact with an antigen, still an immune system response, but it normally shows up days later. It's not an immediate allergic reaction. So it's just a delayed allergic reaction. And it's generally because you are now activating some of the T cells, not just some of the antibodies. Now, this happens a lot when we have any type of organ transplant or any type of tissue transplant, is that the cells, those T cells, are going to recognize the foreign cells in the body as a foreign object, and it's going to target them for destruction. We're not using antibodies to do it. It's just we're going to use some of our T cells, our cytotoxic cells, and just kill. Now, the interesting part is that the host T cells. So if you were given, we're going to say you were given some type of organ transplant, some type of tissue that you needed. I don't know, maybe you needed a new heart someday. If you were given a new heart, your body's immune system would recognize that cardiac tissue as foreign cells, and it would start to attack it. So the host can reject that tissue that's foreign in the body. But the interesting part is the tissue itself that's in the body can reject you. So those cells in that heart that you were just given would recognize your cells as being foreign, and it starts to attack your body. So the graft rejection of the host is that tissue rejects you. So I'm like, either way, it's never good. Normally when you're given some type of organ transplant, tissue transplant, I mean, they do as much typing as possible to try to make sure it's a match, but there's usually going to be some type of drugs to suppress your immune system, because your immune system is constantly patrolling for foreign invaders, and that tissue's foreign. Now, another thing that can happen in certain type 2 and type 3 sensitivities is your immune system starts to get a little out of whack, that it doesn't recognize normal cells anymore. So it lost its tolerance to auto or self antigens, and it actually starts to form antibodies against our own body, some of our own cells, and we start to attack our own body. So it's our an autoimmunity. Anything auto is generally going to mean self. Again, if you think of an automatic car, it shifts by itself. So an autoimmunity is you have immunity to yourself. You're going to have immune reactions to your own body. Now, depending on where this happens, depends on what kind of cells that your immune system is recognizing as foreign. It can develop into some very serious, very deadly diseases. A disease called lupus erythematosus, rheumatoid arthritis, endocrine, autoimmunity, the myasthenia gravis, and multiple sclerosis. Those are all autoimmune disorders where the immune system is attacking the body. This is just showing a couple pictures. You've got the systemic lupus, the erythematosus. The erythema means red, that it is going to cause a facial rash, a skin irritation. Rheumatoid arthritis is that your body's immune system is recognizing that tissue in the joints as foreign, and it causes severe inflammation of the joint tissue that never stops, and it causes a lot of damage to those joint tissues. Graves' disease is attacking cells that produce the thyroxine. You have hyperthyroidism. Hashimoto's disease, it's the opposite. It attacks the thyroxine, but it causes reduced levels. So you've got hypothyroidism. Even type 1 diabetes, that your own immune system attacks the cells in your pancreas, which means those cells are damaged and you have a reduced insulin production. The myasthenia gravis, it's attacking your muscle fibers. It's attacking different cells and receptors that cause that muscle reaction to take place, which means you can't do skeletal muscle functions anymore. Multiple sclerosis, you're attacking the myelin sheath of your nervous tissue. Again, you're going to have severe nervous issues because of that nerve damage. Now for some immunodeficiency diseases. Again, the B cells and the T cells are there to recognize foreign invaders, try to target them for destruction, even try to get those memory cells. But there are still some diseases that can happen. If we damage our immune system. If all of a sudden you don't have enough T cells, enough B cells, you're not going to be able to recognize foreign invaders. So it's called an immunodeficiency disease. Now, some of them can be primary disease, means the body, you were born with it. There was some type of immunodeficiency to your body. Your body just can't make T cells or B cells or phagocytes. You were born with it. Secondary diseases mean at some point in your life after you were born, you acquired an immunodeficiency. So it could be some type of natural cause, something you were exposed to, some type of artificial agent. I'll go over some examples of things that can cause immunodeficiency diseases. Now in your book, there's a big table 16.5, that goes over some of these. But genetic, you could have B cell defects. You just don't have enough B cells. If you don't have any B cells, you don't have enough antibodies. You could have T cells. Some people lack T helper cells, some lack cytotoxic cells, some lack some of the regulatory T cells. Different genetics can lead to different types of T cell deficiencies. Some of the secondary immune deficiencies, so things you acquire. Well, it could be natural causes. It could be different types of diseases. There are different viruses. There are different bacterias that can damage the immune system. AIDS is acquired immunodeficiency syndrome, caused from the virus, the human immunodeficiency virus. The tuberculosis, measles, cancer, diabetes, these are all things that can damage our immune system. Nutrition can damage the immune system. People that don't eat a nice, well-balanced diet for months, if not years, can actually have weakened immune systems. Stress can damage your immune system. It's why if you're under a lot of stress, it's usually the time that you end up getting sick from something, which adds to more stress. Pregnancy can decrease your immune system. Aging decreases your immune system. It's why elderly individuals are at higher risk for picking up different types of diseases. Different types of agents can damage your immune system. Radiation, severe burns, steroids, different types of drugs. If you've got some type of graft or organ transplant, you're going to have drugs that are going to suppress your immune system. But that means you could also, because you're trying to suppress your immune system response to that tissue, but it means you're at a higher risk for picking other things up. Cancer treatments, chemotherapy is going to suppress your immune system, removing your spleen. So there's lots of different things that can lower your immune system, cause you to have less T or B cells. Now, cancer can develop from immunodeficiency. So cancer is just a new growth from abnormal cells. So you've got abnormal cells, lots of reasons they could be abnormal, but they're growing, and nothing's telling them to stop. They will eventually grow large enough into a tumor, and a tumor can be benign or malignant. And if you had to have a tumor, your best bet is to get a benign one, which means it's not spreading. It's self-contained, as you had abnormal cells, new growth, but they stayed put. A malignant tumor means those abnormal cells are spreading throughout their different parts of the body. Now, there's different things that can cause cancer. Again, it's abnormal cells that are growing. There could be some type of error during mitosis, some type of genetic damage, anything that can activate an oncogene, which is a gene that causes cells to divide. Retroviruses can cause some of these cells to start to reproduce. Now, luckily for us, we do have cells. Our immune system, we do have some of our T cells and natural killer cells and even macrophages that are constantly patrolling looking for these abnormal cells. However, if you have an immunodeficiency, if you don't have some of those cells looking for foreign invaders, looking for cancerous cells, if you have immunodeficiency, you're generally at a higher risk for developing cancer. Again, your immune system can recognize cancerous cells and target them for destruction. They're not always accurate, otherwise we would never have cancer, but if you have an immunodeficiency, you are at a higher risk of developing cancer because of that immunodeficiency. All right, so we talked about enough in this PowerPoint. If you have any questions, please send me an email.